COVID-19 cases have continued to drop in Indonesia, and COVID vaccinations in the country have also been successful. As of the 12th of April, 77.6% of Indonesians who are eligible have been fully vaccinated or received the second dose. Although conditions improve, what the pandemic revealed is that Indonesia is still in need of more hospitals. During the spread of the Delta variant back in June 2021, the bed occupancy rate in West Java was 90.3%, which well exceeds the WHO safety standards of 60%. Meanwhile, according to the Ministry of Health, West Java has some of the lowest ratio of hospital beds, namely 1.1 hospital beds per 1,000 people. Collaborations between the government and private companies are needed to add more hospitals in Indonesia. As part of these efforts, an Indonesian-Australian joint venture company, Sanusa Medika Group, is working together with the West Java government to build and operate 650 healthcare clinics and 23 hospitals across the West Java province. During my talk with the CEO of Sanusa Medika Group, Dr. Andrew Rochford, he explained that the project was part of a deep partnership between Indonesian, Australian companies and the West Java government and Governor Ridwan Kamil.
Yeah, so my company, Doctor, has been working in Indonesia now for about the last 6 or 7 years, and I was very fortunate enough to be connected with Governor Ridwan Kamil when he was still the mayor of Bandung, and we worked on some healthcare infrastructure access projects at that time. Then he progressed on to obviously being elected as governor of West Java, and as part of that, his vision is to make a change, to have an impact, to create healthcare facilities that can provide for all members of the West Javan province. And so connected with myself, as well as Aspen Medical, another Australian company, as well as local state-owned enterprise Jasa Sarana as our third partner to create the joint venture company which is Sanusa Medika. And our vision is to deliver up to 23 hospitals and a clinic, a community-based clinic to almost one in every district of West Java. So that's north of 600 clinics over the next 20 years as part of the vision of Governor Ridwan Kamil. And it very much is a joint venture, a partnership, a cooperation between Australian and Indonesian companies to be able to make this vision a reality.
Mentioned, the pandemic has revealed that many countries around the world, including Indonesia, is in need of more and more hospital beds, as West Java has some of the lowest ratio of hospital beds per 1,000 people in Indonesia. So how will this project help close that gap? The COVID-19 pandemic has certainly shown that there needs to be more hospital beds in West Java. So can you just talk to us about how many doctors and hospital beds per 1,000 people will this new project add in West Java?
Yeah, so I think for a very long time, there's been an understanding that there is a significant undersupply of hospital beds as well as medical staff to certain areas of Indonesia, and West Java is definitely one of those locations. Through our facilities, we will be able to narrow that gap, providing upwards of an additional 200 beds to communities and a catchment area of nearly 2.2 million people. And so although that's, it seems to be a small drop in the ocean, a part of this full program is really trying to drive forward how we can close that gap. Close to 60 to 70 doctors will be working on site in our Type B hospitals. Many of those are already working in the region, but also, working at multiple hospitals, having access to international standard, world-class diagnostic instruments, as well as facilities, means that they will be able to provide an international standard level of care that's not necessarily something that people currently across all walks of life within West Java are being able to get access to. So we're very excited about that, and with every hospital facility that we provide and every clinic facility, it's our job to be part of the solution. We're very much working together with Indonesia to make sure that we can create sustainability. We can drive knowledge transfer between Australia and Indonesia, start to assist with the training of specialists, the delivery of these world-class diagnostics, just to be able to give the best possible care for everyone.
So international standard of medical care in West Java and more hospital beds. But will these new hospitals built by this Australian-Indonesian venture be able to provide affordable healthcare? Previously, you were talking about how this will bring a international standard of healthcare to people in West Java. So will this be affordable healthcare? Will these new clinics and hospitals sort of target or be for lower income groups of people as well?
Yeah, so Sanusa Medica's vision and mission is healthcare for all. So we want to provide standard. And when we say international standard, I guess that, that's what Australia does. That's what Aspen Medical does all over the globe. That's what we as a company and as a joint venture are bringing as part of our side of this agreement. And so ultimately, being able to provide that level of care to everyone, from the lower socioeconomic right the way through to VIPs, means that we're going to create a system that helps provide care for everyone, and that it can be provided at a standard and level they can afford, as well as, obviously part of the BPJS system that's already in place, and being part of that solution, not creating more problems.
Meanwhile, this health infrastructure project is also being helped by the Indonesia-Australia Comprehensive Economic Partnership Agreement. Together with Catalyst, which is a business development program that helps connect Indonesian and Australian business cooperations, this Indonesian and Australian joint project is currently undergoing a feasibility study to determine the medical needs in West Java. I want to talk to you about the Indonesia-Australia Comprehensive Economic Partnership Agreements. Has that helped with this deal, and what is the role of Catalyst in making this deal progress further?
Yeah, absolutely. Recent changes that have meant that that's encouraging Australian companies to invest not only their money but also their time into Indonesia, and working with local partners has really helped drive this project forward. And that's very much part of that Australia-Indonesian alliance, as well as new laws around foreign direct investment. And Catalyst, backed by DFAT as well as Bappenas, offering this funding, this grant to be able to mobilise our feasibility studies, is a huge part of how we are going to be able to understand exactly what the community needs, exactly what type of facility, the specialties, the number of beds, the locations. All of those very important factors in generating facilities that are actually going to make a change, and that's all been made possible through the support of Governor Kamil, but also through the Australian-Indonesian Alliance and economic partnership to drive this forward.
So in a large sense, the Indonesia-Australia Economic Partnership Agreement is a big part of this health infrastructure project. And indeed, the development of these hospitals and clinics not only aims to improve medical care, but also aims to increase economic development in the West Java province. And of course, this sounds like a very big project, and development projects also correlate with economic development as well, not just healthcare. So can you talk to us about a projection of maybe how many jobs these new hospitals and clinics will add?
Yeah, so that's part of this. We're not just interested in, can we create sustainability and growth in healthcare? We want to create sustainability and growth in the economics of each of the regions, across the province, but also within each of the territories that we establish our facilities. So when you think about it, to put an exact number on the number of jobs is difficult, but from the beginning of this, we've got local teams and local consultants that we're using to be involved in feasibility studies and environmental and social impact studies. We'll then move into locals related to design, construction, obviously significant number of jobs being made available through the construction phase. Then there's the healthcare jobs, those that will be able to be working within the facility directly as part of healthcare, but also those ancillary jobs around it, support staff, and other economic opportunities that are created when you put a facility like this into any community. And then what we're going to do is we're going to multiply that by 20 to 23 times. And so what we're hoping to do is not just make an impact on the healthcare and the well-being of those within West Java, but also drive economics, drive the stimulus out of COVID-19, push the West Java province and across Indonesia, to reach its potential as being one of the largest economic forces within the world. And that's very much part of what Governor Camille's vision was. He's not just about supporting this project through the development of facilities, but also through economic growth as well, and the opportunities to create jobs.
Can I also ask you, what is the total investment value of this project? And can you tell us about the investment scheme regarding this deal as well? Is it fully funded by the company, or what kind of investors are involved in the funding?
Yeah, so if you do the simple economics of it, I mean, over the life of this project, it has the possibility that there will be more than $1 billion invested into Indonesia, and that's being funded by the companies that are being involved, in a difference between equity components, but also international debt funders. We've got interest from different credit agencies, out of Export Finance Australia, into some of the Dutch agencies, those development funds really looking to invest in these types of projects that are going to help drive healthcare security as well as economic security within the region. And so there is a significant opportunity here for international investment into Indonesia to drive better health outcomes, but also to drive better economic outcomes.